Welcome back. It's not always like what you see in the movies. Clutching your chest, gasping for air. Sometimes heart attacks are subtle and can come with zero warning. In this evening's Healthy You, we're shining light on what you may not know about heart attacks. Every 40 seconds, someone has a heart attack in the United States. In a county where fast food choices are plenty and obesity rates are skyrocketing, heart attacks
are very common in Wichita Falls. We have a lot of heart disease.
The common signs of a heart attack are a tightness or squeezing pressure in the chest or arms that travel to the jaw or back, nausea, fatigue, lightheadedness, and producing a sudden cold sweat. Yet according to the CDC, 1 in 5 heart attacks are silent, meaning damage to the heart is being done without the person knowing it. United Regional's Lisa Turner also says not all heart attacks are alike.
Some women have pain different than men. They sometimes have more nausea and just kind of tiredness. Especially diabetics, they have a different kind of pain just because they're kind of used to different things going on with their body, and so they don't often recognize when they're having chest pain.
And during a time where love is supposed to be in the air, there are things that can mimic a heart attack.
There is a broken heart syndrome, or Takotsubo is what it's called, and it's basically a stress-induced heart failure. We see in patients that are just undergoing a huge amount of stress if they've had a loss of somebody, or it's just lots of different things going on in their life. It can present like a heart attack.
Those who are most at risk for heart attacks are men, African and Mexican Americans, diabetics, smokers, and people with a BMI over 30. And while those who are 65 or older are more at risk for fatal heart disease, a troubling trend has been seen nowadays.
We see people in their 30s and 40s a lot just because of their family history.
The moment you think you're having a heart attack, call 911 immediately. EMTs will have the necessary equipment to keep you stable on board an ambulance. Do not drive yourself to the emergency room. Lastly, know your medical and family history to tell your doctors. And to lessen your chances of having a heart attack,
stay away from smoking, keep an eye on your diet, exercise, trying to eliminate the other risk factors that are there so that you don't have a combination of factors.
And if you'd like to know more about United Regional's door-to-balloon time regarding heart attacks, or for more on their cardiac rehab program, check out our Healthy You page in the lifestyle section over on our website.